Hi everyone, my name is Dr. Chen Tingyu. I'm the co-founder and director of Cytoarm. We are a biotechnology startup companies development novel T-cell therapies for cancer treatment. Our companies consist with research groups and industrial experts who have experience on the fundraising and regulatory and drug development. And we also have the partnerships with global CDMO companies and law firm. So what is T-cell therapies? In human body, one type of immune cells called T cells can eliminate abnormal cells which have viral infections or gene mutations. However, when abnormal cell becomes a cancer cell, the T cell cannot recognize them, so people get cancers. What we do is we teach the T cell to recognize cancer cell. We give the weapons called bispecific antibody to make the T cell become the T cell, so the T cell can recognize the cancer cell and kill them. We isolate the immune cell from the patient and give the weapons bispecific antibody, make the T cells, and put the cell back to the patient body for treatment. The process is safe and fast, and we can generate high-quality drug product with a low cost. So this is our first product, CTA02. And this product is designed to treat colorectal cancer with EGFR downstream mutation. And this type of cancers is only 12% of the 5 years survival rate. So it is urgent medical need. Our data show that CTA02 have the extraordinary ability to kill cancer cells. Also, it can accumulate in tumor region and totally inhibit tumor growth. We also demonstrate these technologies on cancer patient T cells. So this technology platforms, we can generate over 50 T cells products, and each product have individual indications, including leukemias and solid tumors. We also set up a clinical protocol to make sure every step of T cell manufacturing meet GMP and clinical treatment regulation. Compared with our competitor CAR T-cell therapies, T-cell therapies manufactured is faster and safer, and we can generate high-quality drug product with lower cost. Also, CAR T-cell companies will face a lawsuit against CAR T patent owners like Juno. However, Cytoarm developed our own technique. We are leader of the T-cell technology, so we have the global patent protections, and we cannot limited by the CAR T and bispecific antibody patents. So we are Cytoarm. We developed a novel T-cell for untreatable cancers, and we already received several awards and published scientific research papers. And in this year, Q4, we will apply phase 1 clinical trial of our first products in Taiwan and United States. Thank you.
So hello, and tell me a little bit about the Cytoarm. Where did you start? How did you get the idea?
Okay, so, we can go back 10 years before, and in the very beginning, bispecific antibodies is a drug. It direct inject to patient, but it generates some problem, including its half-life is very short, so the patient need to carry a pump to continually inject the bispecific antibody in the patient body. So we are thinking about why we don't just add the antibody in our lab to connect with T cells and put the T cell back to the patient, so we can avoid above problems.
And tell me a little bit about why would you want to do the T cells, just the principle, so that our listeners can, viewers can understand why this is important.
Okay, the T cell is one type of the immune cells. So it has ability to kill abnormal cells, but it cannot identify cancer cells.
Yeah.
So we give the weapon called bispecific antibody, and we call the empty cells. So the arm T cell can identify the molecular expression on the cancer cell surface. So they will trigger T cell activation and release some cytokine and cytotoxin to kill the cancer cell.
And at the moment, before you started, there were other solutions on the market. Is that right? There were other T cell solutions available.
Yeah, it's many different cell solution will kill the tumor cell. Like 2018, the CAR T cell therapy make the breakthrough of the unmet medical needs of the leukemia patient. Our company start up with this concept, but our technology won't use the virus to let the T cell, immune cell, to express the weapons to kill the tumor cell. We use the bispecific antibody to target the tumor cell, and this bispecific tumor antibody can change to different kind of tumor. So we have an advantage to change any kind of indication to meet our unmet needs.
And how long did it take you to develop this, your specific technology?
Yeah, it's a very long time. I
Yes.
would say it's very hard because the regulation is very strict, and we need to meet the criteria to meet the high quality cell products. So about 10 years.
Wow.
We need to
Yeah,
develop
probably.
products. Yeah.
Yes, that's typical in sort of pharmaceuticals and drug discovery. And
Yeah,
right.
it's-
yes, and you've got backing with. It's not just in Taiwan. You've got international backing. Is that right? You've got people working with you from international.
Because the United States and Europe have already approved CAR T very beginning. So this is our the first market, and also Japan and China and Singapore recently also approved the CAR T cell product. So we believe that those countries are very welcomed for those novel cell therapies for treatment. So we also applied a global patent on those countries to protect our product, and we have continued to looking for clinical partnership in those countries to launch clinical trial in the future.
But have you started any trials elsewhere, or is it still mostly here at the moment in Taiwan?
No, we didn't have set the clinical trial, but we are going to find the doctors in hospital to diagnose fix the criteria of the patient to meet our products. And because this is important, where our product is the most important thing is the untreatable patients now. Yeah.
And in terms of what you've been able to prove so far, what has been the response from the community that you're trying to get this into?
Well, cell therapy is a very new technology for Taiwan, especially, and so we welcome clinical doctors or CDMO companies to maybe contact us to cooperate to develop our anti-cell therapies. And this week is computer text, which means Taiwan is full of computer technology, but we still lack of biotechnology. So Cytoarm may be the chance to become a unicorn biotechnology startup in Taiwan and make Taiwan becomes inventions hub in cancer treatment.
But to get to the unicorn status, what are the things you need to achieve to get there? You're still very early stage, I guess.
Yeah, I think we have achieved many milestones. Most importantly is our bispecific antibody production. This need to meet the GMP grade.
Yeah.
And next is the cell production.
Got it.
The cell production is very important in Taiwan. We need to meet the GTP grade of the cell production. So
okay.
this all needs many money.
Okay, so that's your next step, raising some finance.
Yeah, but fortunately, this year, maybe March, we just closed pre-A round fundings.
Okay.
We have 200 million US dollars. So this is a very good beginning to apply the preclinical trials in the end of this year.
So how long do you think it will be? I know these things take a long time. How long do you think it will be before we see this drug available to sort of cure certain types of cancer?
Actually, because the novelty of the cell therapy, so cell therapies can get a condition approval after we pass phase 2 clinical trial. So it will not like a traditional drug. It need to take a lot time to pass a phase 3 clinical trial. So I estimate maybe 3 years.
Yeah, okay.
We can have a very good result in phase 1-2 clinical trial.
So what's your next step for this next 12 months? What do you want to do?
Always is the cell production.
Okay.
The cell production is very important. And to meet the, I would say our stage here is the most important thing is to apply the US FDA IND, and this is the most important milestone in our current next 12 months.
Wow. Okay. Well, I hope it goes well there, and thank you very much.
Thank you so much.
Thank you for having us.